Press the bell icon on the YouTube app to never miss a video from News Laundry.
Stretchers, row after row. Comatose patients in isolation rooms. Every surface is dangerous, and so is the air, especially during an intubation.
Every day you're thinking, am I going to get really sick? Am I going to be able to recover? Am I going to be one of those young people that, for whatever reason, dies from this?
The history of this pandemic will be remembered not for briefings at the White House, but for the heartache in the hot zone.
Welcome to another episode of News Laundry Interviews. I'm Snigdha, and joining me today from New York is Michael Kirby Smith. Michael is a filmmaker and a photographer based in Brooklyn, and he works as a senior visual journalist for the New York Times, where he contributes as a photographer, a filmmaker, and a producer for special projects. And he also works on a variety of commercial, editorial, and nonprofit publications. And he is a 2014 Pulitzer Center on Crisis Reporting grantee, for which he reported from Yemen, the war in Yemen. And most recently, Michael and his fellow journalist, Kristof, visited 2 New York City hospitals to document how medical workers are treating COVID patients. And the report is titled Heartache in the Hot Zone. And the New York Times video paints a stark picture of how overcrowded the wards are, and stretchers are from bumper to bumper, and healthcare workers don't have a moment of rest. And you shot the video over 2 days. Am I right, Michael?
Yes, that's correct. The first day we filmed in Montefiore Hospital on, I believe, the 5th, April 5th. Right. And then the second day was April 8th, so that Wednesday. So it was a compilation of 2 different hospitals that we visited.
Right. So, Michael, my first question is, how did you manage to get inside these hospitals? Did you face any trouble getting permissions?
Well, Nicholas, my colleague Nicholas Kristof, had sent out had written a piece about and talked about, in the piece he talked about not having access to a lot of the hospitals, so that, a lot of the reporting wasn't getting access to the front lines. And so he got response from some doctors, and then through that, I believe that they negotiated access for him, and then it was another negotiation to get access for the photography video side of things. Right.
Obviously, hospitals are overcrowded and health workers are overworked. And there's so much chaos. Through the video you could see, So how are health workers managing to bring some form of order, amidst all this chaos? What did you see? Can you just give us a brief account of what you saw at these hospitals?
Yeah, I think that first off, not one of these hospitals is really equipped to they do not have the infrastructure in place to deal with the amount of patients that are coming in at the speed in which they are coming in. And so every single one of the hospitals is improvising and coming up with their own techniques and ways to kind of deal with the massive amount of people that are coming in. I would say from the 2 hospitals that we visited, in terms of the healthcare workers, they're under extremely stressful situations, and they're asked to not only be working above and beyond their normal routines and jobs, but on top of that, there's a large emotional toll, because a lot of the patients within the ERs are not able to be with their family and their loved ones, and so the comfort is kind of put upon a lot of it is put upon the nurses and the doctors to try to provide comfort for many of these patients.
Right. In the story, I remember a health worker mentioned how, they don't even have time to process all the emotions because people are dying so frequently. And she goes home and she cries. That's what she was saying. So have you heard of any initiatives in America and New York especially to, support the mental health of these workers?
No, not that. I mean, I'm sure that they exist, and I believe that there's a growing awareness of the mental stress that healthcare workers are currently under. So I imagine that there is a lot of people that are actively trying to figure out ways to give more support to the healthcare professionals. It's not something I've reported on personally, so I don't know if I'd feel totally comfortable, expressing that because I haven't reported on it. But yeah, I mean, I think that what I can say is in New York alone, I mean, just as an example, every night around 7 p.m., windows around the city open up and everybody, starts cheering and clapping for, healthcare workers, for essential businesses, for firefighters, police workers, all the people that are still, operating at a professional capacity to keep the city moving forward.
Right. And what's the situation like right now? I just saw that I think it's compulsory for New Yorkers to wear masks from tonight onwards. Yeah, but otherwise, I mean, are people, do you see a lot of people out and about, what's the lockdown? What is the situation like right now?
Well, I mean, I think I see a lot, with a city the size of New York, it's hard to have an accurate assessment as to what's a lot of people on the streets, because even if it's very sparse in New York terms, in comparison to a lot of places throughout the United States, it would still be considered, a high number. I think that the awareness has definitely really set in, and the social distancing seems to be getting better for sure. And, the streets for the most part, especially in Manhattan, seem very empty. But, I think it's a hard thing to assess accurately without really focusing and spending time on the streets to give a better perspective.
Right. So, Michael, do you think New Yorkers, or at least, Americans, are they seeing it as a national tragedy, something like 9/11? How are they looking at the pandemic?
I really don't know how the rest of the United States is receiving this. I mean, I think that, to go back to the reporting that we were doing in the hospital, one of the things that was a big takeaway for me personally was the pleading that the doctors and the healthcare professionals they were pleading for the rest of the United States to look at New York as an example of what's headed towards them, and to, consider that the only thing that they're asking is for people to respect the social distancing that has been requested by medical professionals and scientists. And I think that that's a pretty small request, taking into consideration the sacrifices that they have been making, not seeing their family, working extra hours, the physical and emotional toll that working at this capacity has. I really hope that people look at the report and look at what's happening in New York as to take it seriously.
Right. Michael, what were some of the important factors that you and your team considered before you decided to do this story? I mean, did you get any, and especially what happened after you finished the story? I mean, did you receive any help or instructions from authorities or the hospital about self-quarantine?
We definitely have a lot of team discussions before and a lot of team discussions afterwards. I think, we actually try not to talk about the specifics of, all the kind of protocols that we, go through both before and after to kind of ensure safety. With that said, I felt very confident with the executive producer and the different desks that were working on the project in kind of coordination and giving support to just make sure we were comfortable every step that we took. And if there was ever a point that we felt like uncomfortable in any capacity, there was always the ability to just stop what we were doing and decide to call it a day. So
Right. And Michael, just yesterday I was reading this report about how a nurse in Providence, St. John's Health Center in Santa Monica, California, was suspended and slapped with an HR investigation for refusing to work without N95 respirators. And there was another New York Times report about a health worker of Indian origin who actually died. Her name was Madhvi Aya. And so I just wanted to ask you you went to these two hospitals. What's the status of, PPEs right now? Do health workers have access to enough protective gear? And are there enough ventilators? What's it like right now?
It's hard, for the two hospitals that we spent time in, everybody had proper PPE. I think that there is a concern from management of how long that will last. I think there's so many unknowns that are still happening. I mean, there's so little that we still know about the pathogen that we're still figuring out and still adapting, what we think is considered good, safe protocols to abide by moving forward. So, they had expressed that I think that there's known shortages for ventilators, for PPE, not just in New York, but elsewhere throughout the United States. I think it's hard to assess that specifically without really diving into the reporting because it really depends on kind of your view of longevity, like how long you think that this pandemic is going to last for. Right. With that said, safety was a huge factor for the hospital. They had specific PPE monitors that were designated within the ER to make sure that, nurses, doctors, additional staff members of the hospital were complying with the PPE that they were required to wear, and then also the protocol of how to, put it on, take it off, what to do, what not to do. And that was a really important factor because, as you can imagine, most of the people in most doctors and nurses don't have a ton of experience in doing their job in complete, PPE. And so because of that, it's easy after long shifts to, want to touch your face or, you're tired and you're exhausted. And so I think it's helpful to have somebody that's constantly reminding you to remember to not touch your face or to.
Were you guys told the same when you were shooting inside the hospital?
Yeah, we were told the same for sure. We went through the same kind of PPE, getting dressed and undressed as the doctors and nurses. And then we also had, a doctor that was with us to kind of help guide us and make sure that, when we took a step forward, it was a step forward that was okay to take. And that gave us a certain sense of comfort that I think was really important for us to be able to do our job.
Right. And Michael, I think just today, New York City has announced 10 new testing centers for low-income areas. I just wanted to know, because even in India, there's a massive migrant crisis. So there are a lot of poor people who come to big cities, right, to work as construction laborers and so on. And they are facing the most amount of trouble right now. And I just wanted to know how poor people in America are managing to get treatment. And, given that in the healthcare in US is heavily privatized, just like India.
Yeah, again, don't mean to skirt the question. I don't know if I'm the best person to answer that because I haven't reported directly on it. What I will say is that I do believe that the testing in general is going to be a growing debate, not just within the United States, but, throughout the world as we, because of the nature of this virus, we are being forced to come up with tests at a faster pace than we normally would. It's not going through the same levels of scrutiny. And because of that, I think that there's a real risk if, people aren't listening to the medical professionals and the scientists in terms of what tests should and should not be used, there is a risk that the testing will be politicized. And I imagine that if it was politicized, that the people that would be most affected by that would be the lower income communities.
Right. And Michael, is there any experience that, any incident that really stayed with you that you would like to share with us while doing this report?
I think just, I think what I would say is that there's a big emotional toll. And I think that, there's people from age 26 to, I think 91 was the oldest patient or close to it. So there's a lot of misconceptions that the virus, doesn't affect young people. I think that it's very clear that it does. I think it was clear in that environment as well, just talking to a lot of the doctors and nurses and the people that they've been treating. I think that taking into consideration that most of the time when you're going through an experience like this, you're able to be with your loved ones, you're able to communicate with them. Most of the time they can come and hold your hand and spend time with you. In this particular situation, they can't. Family members are not allowed to be in the ERs or the ICUs. And because of that, the doctors and the nurses are holding patients' hands. And, these are professionals who, patients look to provide answers. And they don't have answers in this situation, and I think that that's a hard thing for them to face. And so I think there's an emotional toll, and I think that there's a real, like I said, the doctors and nurses were pleading for the rest of the world and the United States and beyond to listen and pay attention and learn from the lessons of what's happening in New York. To better prepare, because the reality is that New York was not prepared for this. New York could have been prepared for this, but it wasn't prepared for everything that's unfolding right now.
Right. Michael, you've covered the war in Yemen, and how is reporting on a pandemic different in the sense that in both situations you see a huge number of lives lost. How is this different?
I think it's, different in the sense that, reporting most of the reporting that I've done abroad and also, within the United States, you have there's a face to what, people are up against. In this particular situation, it's a virus and it's, there's so much that we don't know about it. That it's hard to kind of wrap your brain around, the toll that it's having on people. What I would say more than the difference is noting the similarities and the kind of, that in moments of crisis, people tend to come together and show compassion, at least the people that are directly, trying to help and ease the conflict on the front lines. And so, there are a lot of human similarities that I think, can inspire us to, show compassion to our fellow neighbors.
Right. And I think this is my last question. What is the role of a journalist in your eyes in a crisis like this?
I think the role of a journalist is to, show what is happening with as much, honesty and report on it in a way that, really gives people who can't be on the front lines a view into the reality that's happening, so that, issues aren't politicized and that they're assessed for what they are, based on facts and based on reporting and based on, what is seen from firsthand experience. I think a huge part of my interest in doing this story was at the point that we just hadn't seen the severity yet, or at least I hadn't, here, even though we knew that it existed because the numbers were telling us that it did. And it's important to see it because that's where, again, change is, I think, really driven by an emotional reaction to something, and seeing things from on the front lines. I think people will react on an emotional level, and I think that's really important.
Right.
I mean, it's important to put yourself in the shoes of others, and I think that through frontline reporting, it does exactly that.
Right. So, Michael, so as a journalist, where do you draw the line? Because, in India recently, the ministry issued like an advisory sort of for TV media especially, to focus on positive news, but that sort of adds to the delusion, right, of people thinking that everything is fine. What do you think of that?
I mean, I think it's important to report on, all stories, positive, not so positive ones. But I think it's our job to present what we see in the most honest way that we can, based on the facts that we're seeing and experiencing firsthand. Fortunately, I have worked almost exclusively for, publications and journalistic institutions that I believe in. Mm-hmm. I don't think I would accept assignments if I didn't believe in the institution that I was working for.
Right.
And if I ever saw that there was a certain bias being pushed, that I could directly, report on behalf of, then I would certainly step back from contributing to that publication.
Right. And
it's a hard place. It's a hard thing to negotiate.
That's true. That's very true. And do you have any advice for journalists who are covering COVID-19 from the front lines?
I mean, I would just, say to just be really methodical in the safety. I would say to just really, be aware of the safety protocols that you're putting in place for yourself, and to not do anything for anybody that you don't feel comfortable doing, and to really kind of weigh the fact that there's still so much that we don't know. So it's hard to assess, it's hard to assess what risk you're taking in this particular situation. But yeah, I mean, just being, super careful and slow and diligent in how you work so that you don't make mistakes that jeopardize your safety.
You're right. Thank you so much, Michael, for your time.
Thank you.
And stay safe. And hope we meet again.
Yes, I hope so too. Take care.
Okay.
Thank you so much.